Okay. So, hello, I am Michaela Petty, the epidemiologist and shared service coordinator for the Greater Boroughs Partnership for Health. And today we're joined by Dr. David Hammer from Boston University, who will be talking with us today about H5N1 or avian influenza. But before we get started, Dr. Hammer, I'd love to give you a chance to introduce yourself and tell us a little bit more about who you are and what you do.
Sure, it's a pleasure to be here. Thank you for having me. I'm an infectious disease specialist by training. I do a lot of sort of medical epidemiology now. I run the travel clinic at Boston Medical Center, but I think more importantly, I'm involved in a international surveillance system that's called GeoSentinel that looks at returning travelers, immigrants, and refugees, and tries to define in what parts of the world they became infected and when they return to their home country or to the country that they're moving to. And that has led to a very strong interest in surveillance systems, but also emerging infectious diseases.
Well, we're honored to have you here today and get to hear from you and kind of share in your expertise. So, as I mentioned, we are talking about avian influenza. So, kind of just to level set and get started, can you kind of define what avian influenza is and how it's different from kind of our regular seasonal flu?
Sure, it's avian influenza is really sort of a term that means bird flu, and it is due to strains of influenza, usually influenza A, that are have a different combination of what sort of the major structural proteins that we use to characterize influenza. So those are called neuraminidase and hemagglutinin. And so this got its name because it's been found predominantly in bird populations. And we'll talk more about sort of where it is now. But there are different strains that have been predominantly found in birds, and they're characterized by which hemagglutinin and which neuraminidase they have. So just as an example, in the types of influenza that generally affect humans are influenza A and B. This year, we've had a lot of influenza A H3N2 as a pretty big problem. It's finally calming down in Massachusetts and the Northeast of the United States. Bird flu is the one that's been pretty widespread globally in recent years is H5N1. So you'll hear that H5N1. It's also sometimes nicknamed highly pathogenic avian influenza. And the reason for that is that the earlier outbreaks of this strain of the virus were predominantly in Southeast Asia, East Asia, China, Vietnam, a number of other countries in the area. And it's much more widespread over recent years. I mean, I think the Middle East, like Egypt, has had cases, South Africa. Um, those cases were usually just a single person or a couple family members that had exposure to heavy exposure to birds, usually backyard poultry operations. And the reason it was called highly pathogenic was if you look back over like 20 years until very recently, something on the order of 30 to 50% of the people that became infected died. So a very high case fatality rate. And for that, and within bird populations, it can decimate bird populations with many, a high proportion of them dying from this strain of the virus. And so I think that's how it got the name highly pathogenic. As we will discuss in a few minutes, it fortunately hasn't been that bad in terms of human cases.
Yeah, thank you for explaining that and kind of the difference between how it infects birds and humans. And kind of going off of that, how does a flu virus that typically infects birds um, jump to humans? And kind of this has been prevalent in birds for a long time. So how likelihood likely is that risk normally? And then kind of why are we seeing this increase recently in jumping to humans? And thinking about those kind of transmission pathways, we haven't seen it yet in terms of human to human transmission, but just thinking about the flu and the virus itself, what is required for human to human transmission to occur?
Okay, so that's a great question, and the answer lies in the virus. As of now, it tends to bind to receptors much more in the lower airway. Um, if it evolves and can bind better to upper airway receptors, then that means there's going to be a lot more virus being transmitted through coughing, sneezing, and even breathing, sort of aerosolized, as we saw with SARS-CoV-2. And so really, if the virus is able to pick up the right genes that allows it to cause more of an upper respiratory infection, then there's a much greater potential for movement from human to human.
That's helpful. And I think we've done a good job of talking about flu virus itself and the nature of the virus. So, kind of honing in on the current situation, we have seen some human cases of H5N1. And what have we seen the severity, kind of thinking about how it has manifested in humans?
Uh, it's actually fortunately been pretty mild. There have been a couple reports in both the MMWR, the Morbidity Mortality Weekly Report put out by the CDC, and then a recent one in the New England Journal of Medicine. And basically, most human infections have been pretty mild. It's been either conjunctivitis, and I think that's because of direct contact with the virus through the cow udders or on the surface of a cow, and then people rubbing their eyes. Um, um, at least potentially direct inoculation by that route. Some have had mild respiratory symptoms, sort of a runny nose and a cough and maybe a low grade fever. There have been very few that have been really sick, but there has been one death of a child, and so that sort of made all of us a little bit nervous. But I mean, I'd say overall, most of the reported cases have been very mild. And some have been asymptomatic. Some people have basically seroconverted without having had any clear symptoms.
Which I think it has been a silver lining of some of the news reports is this more seemingly mild severity. Um, and thinking about this outbreak compared to past outbreaks, kind of what can we learn from past uh, avian influenza outbreaks that kind of give us insight as to what this means now, and what that might look like?
It's tough. I mean, because most of the past avian influenza outbreaks have really affected birds primarily and not so much human. There have been a few sporadic human cases. In this case, we've had quite a few more. I mean, I think the CDC, what was the number? We've had 70 cases since 2024 in the US. And with 41 of the 70 having dairy herd cattle exposure, 24 poultry farms and culling operations, and then 5 various other exposures. So we've had a good number of human cases, but most of those have been pretty mild. And the past epidemics have been really mostly a single case here, a single case there, a single case there for humans. But in some cases they've decimated poultry operations. Or they've identified them and they've gone in and says we have to cull all the birds so this doesn't spread any further. And unfortunately that's still a strategy that's being used. Well, I mean, I say unfortunately, it's unfortunate to all the uninfected chickens, but we can't let it keep spreading. And so that is a good method for control, even though it has implications for the sort of economic implications for the farmers who are losing their all their chickens.
Yeah, I think, and that kind of answered my next question was kind of how is this different from what we've seen before? And it sounds like kind of the scale and the scope, and the number of human cases that we have seen is different than what we've seen before. So kind of thinking about that and moving forward, you touched on wanting to talk about what we can do. And um, before we get to that point, I want to talk about what is being done in terms of to try to control the spread, but as also monitor and surveil additional cases?
Uh, so that's a good question. There's a lot there. I mean, I think that the USDA and CDC have been trying to work to enhance surveillance, both for poultry operations, but also dairy cattle. And I'm not convinced that they're getting all the resources they need from the federal government, but they're getting some. So I think that's one is to just do active surveillance and different domestic animal populations, sort of chicken operations, poultry operations, as well as cattle. I think we need to keep continuing to do wild bird surveillance also. And if there's a die off of wild birds, we need to understand why. But then we need to work on protecting people that are going to have direct exposure to those. And so, one important level is anybody that's working with dairy cattle, but also people that are in the poultry operations, sort of basic precautions, ideally gloves, hand washing, potentially if there are definitely infected animals, then wearing a mask and protective eye gear become important. The challenge is that a lot of times these, people managing these animals are either, migrant workers that may not, have access to adequate protective measures, or it's just the context where it's just too hot and humid to be wearing gloves and masks and so forth. But I think personal protective equipment is important. I think that another question is going to be, what point do we start trying to use an H5N1 vaccine as a protective measure? And there are H5N1 vaccines that have been developed, but they're against a different strain. So we have these stockpiled across the country. I know that there's work going on to target the specific strain that's been most widespread in the US. I'm not sure those vaccines are ready quite yet, but vaccination could become part of the response.
And a little bit more on that vaccination. Is that targeted towards chickens or is that a human vaccine as well,
I'm
though?
really thinking about humans. I don't know that anybody has take developed a vaccine to try and do mass protection of chickens. I mean, that would be ideal because I'm worried that if we keep getting outbreaks in poultry operations and then the response is we have to cull them all, the price of chicken and eggs is going to rise even more than it has already.
Yeah, and the impact on the industry is already being felt. So trying to minimize that. Thinking about there's the commercial operations, but also here locally, we do have some individuals who have backyard flocks. So what would you say to those individuals that have backyard flocks in terms of protection and monitoring?
I think I would monitoring for the any evidence of illness in in their birds is going to be important. And if they, start having birds becoming sick or dying, they need to report this and ideally, provide access to the birds or to the dead dead poultry to the state so that they can be analyzed for potential infection with H5N1. I think people should have like even just putting aside H5N1, if you're having a lot of contact with chickens, they can carry Campylobacter and non-typhoidal salmonella. So really, sort of any contact, you should have good hand hygiene. I think for routine contact, you don't necessarily need a mask, but certainly if there's any evidence that chickens are sick, then a mask would and potentially eye protective eyewear if there's the likelihood of being in close contact and potentially being sprayed by the chickens. So I think it really is sort of common sense to some extent.
Yeah. Yeah, I think about this a lot too of birds generally you don't want to touch them anyways. But especially now, or if you are like with backyard chickens, taking those precautions. And then taking one step back into just kind of the general population, um, feels like there's a lot going on right now and trying to think about for the average person that doesn't own chickens or cows, what is the amount of space this should take up in their in their mind, and are there any type of precautions that they should be taking in terms of the general public.
I mean, I think at this point, the general public does not need to worry too much with the exception of raw milk. Because of the potential for live virus to be found in raw milk. There were a set of studies done, I guess it was really last spring, roughly about a year ago, or a little less than a year ago, looking at pasteurization of milk and what impact it had on H5N1 in milk samples. And pasteurization works. I mean, it kills virus. And so, the issue becomes, people that think that there's some health benefits of drinking raw milk can be dangerous not just for the potential transmission of H5N1, but for other pathogens such as Campylobacter. So raw milk, and then unfortunately it extends to, well, raw eggs have always been a little bit dangerous, but I would extend it to uncooked or inadequately cooked eggs, um, and then raw milk cheese, and there it's probably not safe, but they're, like some raw milk cheeses are stored for 60 days or longer. And there's some evidence that the processes of storing and the chemical reactions that go on might kill off the virus. But even then, there was an article or two recently suggesting that live virus still might be present after sort of a typical, 2 month of raw cheese or of cheese production. So I think we need to be cautious with raw milk cheese in the US. I'm not sure we should sort of just say stop eating it altogether, but if we see any outbreaks by this route, then we're going to have to change our eating practices and or our cheese, production processes.
Yeah, absolutely. Those are really good points to bring up, especially for someone who might enjoy raw milk. Thinking about how that can have an impact, especially with other infectious diseases, not just H5N1. Um, so far, this is most of my questions. I think is really helpful to have kind of a level set of what avian influenza is, where we're at, where we have been, and what we can do. But before closing, would like to open it up if there's any other information that you feel is important for people to have, or knowledge about avian influenza.
Yeah, no, I think one important thing is just like if somebody develops symptoms consistent with influenza, what we call, an influenza-like illness, which is usually fever, a dry cough, sometimes, a mild conjunctivitis like runny eyes, nasal congestion, um, and certainly actually conjunctivitis is a manifestation, has been a manifestation in some of the cases of bird flu that we've seen in the US. Um, you need to try and get tested. Either a rapid test for influenza, which may pick it up, or more of a molecular test that can be done, through your doctor's office or a hospital. And we need that's one step. The thing is that these rapid tests don't differentiate influenza A sort of normal types from the H5N1. And so it's more specialized tests have to be done. And so I think that we need those to be done quickly in order to be able to identify potential human cases. So I think for the general population, that's not so relevant. That really becomes a lab issue. But for the general population, if you have influenza-like illness symptoms, get tested. And then the other part of this is we have drugs that work against influenza A. We have a family that are called neuraminidase inhibitors, and Tamiflu or oseltamivir is like one of the most common ones that has activity against H5N1. So if you start treatment early, if you make a diagnosis and start treatment early, you're going to have a reduction in the duration of symptoms. And so, I think that, there's a reason to be tested, and then for certain individuals, depending on age, underlying medical conditions, treatment can be indicated and can be helpful.
Awesome. Yes, that's super helpful as a reminder. And as someone who uses the test data to help monitor in our own communities, knowing that getting tested is really helpful on the data side, but also, like you're saying, on the treatment side. Um, but I think that's all we have for today. And I really appreciate you taking the time to speak with me today and answer all of our questions.
My pleasure. It was great to be with you.
Thank you.